Okay. Hello, my name is Rich Kitcher. I'm a student nurse, and today I will be putting in an NG tube and removing it. Before we start, I do have to ask you, do you have any allergies to anything we will be using in the procedure today that involves any plastic? We're going to use alcohol wipes, anything of that sort, any adhesive?
No.
Okay, perfect. And then I also have to ask, have you had any procedures on your nose? Maybe a septum piercing, a deviated septum, a broken nose even?
No.
Okay, perfect. So, what was on here? I'll start by getting my tape. Put the drape down, get this, just in case there's a little bit of a mess. Okay, I'm going to take this out. I'm going to measure from the nose behind the ear to the xiphoid process, and I'm going to add 10 centimeters afterwards. Okay, nose, behind the ear, the xiphoid process right there. That. Okay, it's going to be about 60 centimeters, and I'll add 10 more, so it'll be 70. Okay, put this back down real quick. Make sure this is all good. Okay, I was supposed to mark it, so I'll do that again real quick. Let's keep rolling. Xiphoid process. Okay. It's going to be at about 57 centimeters. We'll add more. We'll go to 67 centimeters, and this time I will mark it. You can use a marker as well, but I'll use tape today. Perfect. Okay. So now that I have marked it, I'll be sure to put that there for the patient just in case anything comes up. And then I'm going to add adhesive to the tip of the tube. It's going to be about 2 to 4 centimeters. So I would add the adhesive, just verbalize that. And then I'm going to put the tube in. I would tell the patient this is going to be a little uncomfortable, but I'm going to do this as quickly as possible. All right, so I'm going to have you lean your head back, put it in. Perfect. I'm going to have you grab a drink of water real quick and sip on that. Typically, I would have another person here to help hold the water, so I'm just gonna sit that down there. Okay, and I'm gonna lead you forward. I'm gonna have you touch your head to your chest, or your chin to your chest, and as soon as I say go, I'm gonna need you to sip the water. We're gonna get the tube down there, okay?
Okay.
All right, so 3, 2, 1. Okay, because this is a mannequin, it's not going to go down all the way, but typically we want to go down to around where we marked. That's good, I will take this away. Put this over here. Okay, so now to make sure the placement is correct, I would use my pen light here. Have them open their mouth, look inside, and see if I can see it in the back of the appendix, which I can, so that's good. There. I'm also going to drop some bile. I'm going to check the color, the consistency, and I'm going to test the pH as well. Okay. Just a little bit. Okay. So we check the color, you can see in the pH. We look at the pH strip and make sure it's under 5.5, which is, we're just gonna say it is, which is good. And the color should be a dark greenish sort of color as well. This should be not thick. Okay, so we've done all that. I believe we can make sure the tube is secure in place. So I'm gonna use my tape to do so. I'm going to actually rip one of these pieces of tape so we can wrap around here. And I would be sure to use an alcohol wipe before this part of the procedure, just to make sure there's no irritation on the patient's nose. Okay, remove this drape, and then if this were also a real patient, we want to make sure we get up to the pump so this isn't going everywhere. But because it's not, I'm going to actually take a piece of tape here, wrap it near the bottom here. Okay, I'll take a pen. That through. I'll put that on the patient's gown. And before we finish and leave the patient, we would want to make sure that they can move their head from left. We would ask the patient to move their head from left to right to make sure that there is no restraint where the tube is clipped down so they can't move their neck. So after this procedure, I would take off my gloves, perform hand hygiene, and do all that, but because we also have to remove the tube, I'm also going to demonstrate how to do that. So I would do the same thing when I came in. I would check the patient's ID, their ID band, verify their name, date of birth, all that, make sure it's the correct patient, and then I would let the patient know, okay, today we're going to remove the NG tube. So first, you would want to measure and make sure that the NG tube hasn't moved. We'd say, okay, it hasn't moved. And then you want to pump some either air, 30 to 50 milliliters of air, or you want to do 10 milliliters of water or saline into the tube so you can clear out any bile that's in there, so when you pull out the tube, it does not irritate anything in the nostrils. So we would draw up 10 milliliters of saline after putting this on. Mess here. Okay, so now we would draw up 10 milliliters of saline. Okay. Put that in. Okay. Now we've already measured. Make sure that it's in the correct position. So now we should be good to take the tube out. So I'm going to have to take this piece of tape off the patient. I'm gonna tell the patient to hold their breath so we can do this as quickly as possible. I would say 3, 2, 1. Pull out the tubing. Okay. Wrap this up, and I would throw this bundle into a biohazardous container so that it's safe. That is a biohazardous container. I would ask the patient if there's anything else they needed before I left. And make sure there's nothing by the nostrils, no leakage, nothing of that sort. And yes, I would ask the patient if there's anything else I can do, such as like oral hygiene if they can't do it themselves. But if not, I would take off my gloves, perform hand hygiene, and check on the patient regularly.